Phenylephrine. Phenylephrine is a pure α₁ agonist that causes vasoconstriction, raises blood pressure, and serves as a nasal decongestant and mydriatic. The curious eye drop. A medical student receives eye drops before a retinal examination. Within minutes, his pupils are widely dilated, yet he can still read his phone without difficulty. How is that possible? The answer is phenylephrine. Phenylephrine is a selective α₁-adrenergic agonist that contracts the radial muscle of the iris, producing mydriasis. Importantly, it leaves the ciliary muscle unaffected because accommodation is controlled by muscarinic receptors, not α₁ receptors. As a result, accommodation is preserved, allowing the patient to continue focusing on nearby objects despite having dilated pupils. Mechanism of action. It produces vasoconstriction by stimulating α₁ receptors on vascular smooth muscle. This increases peripheral resistance, which in turn raises blood pressure. As the blood pressure rises, the body responds with reflex bradycardia. This occurs because the rise in BP triggers vagal stimulation, leading to a compensatory slowing of the heart rate. Phenylephrine also produces mydriasis by contracting the radial muscle of the iris. Since it does not affect the ciliary muscle, it causes pupil dilation without cycloplegia, allowing accommodation to remain intact. Adverse effects. Phenylephrine can produce predictable adverse effects due to excessive α₁ mediated vasoconstriction. The most important is hypertension, which is the primary cardiovascular risk. The sudden rise in blood pressure can trigger reflex bradycardia through vagal stimulation, leading to a compensatory slowing of the heart rate. Some patients may also experience headache and anxiety, often accompanied by restlessness because of elevated blood pressure and sympathetic stimulation. At high doses, excessive vasoconstriction may reduce organ perfusion, causing ischemia, and prolonged local use can also produce local ischemia. Clinical uses. As a nasal decongestant, it causes vasoconstriction of the nasal mucosa, reducing congestion and improving airflow. It is also used to treat hypotension, particularly during anesthesia, where its potent α₁ mediated vasoconstriction helps restore blood pressure. In ophthalmology, phenylephrine serves as a mydriatic agent, producing pupil dilation for ophthalmic examination without cycloplegia, so accommodation is preserved. Another important use is in priapism, where local injection constricts blood vessels, helping resolve prolonged painful erections. Key takeaways. It is a pure α₁-adrenergic receptor agonist. By stimulating α₁ receptors, it causes vasoconstriction, which increases peripheral resistance and raises blood pressure. The rise in blood pressure may trigger reflex bradycardia through vagal stimulation. In the eye, phenylephrine produces mydriasis without cycloplegia because it contracts the radial muscle of the iris while leaving the ciliary muscle unaffected, so accommodation is preserved. Clinically, it is used as a nasal decongestant for hypotension, as a mydriatic agent, and in priapism. The major adverse effects are hypertension, reflex bradycardia, and ischemia.